I have Ehlers-Danlos Syndrome, and so do my two daughters who are aged 20 and 23. Ehlers-Danlos is a connective tissue disorder. It's a genetic condition. It's degenerative. It's lifelong. It's extremely disabling. It's very complex and it's multi-systemic. There is no cure for EDS and there's very little in the way of treatment at the moment. It's had a huge impact on our family. It started when my daughter was born with dislocated hips, and she had a whole raft of complications and health issues from a very young age. And when she was 12 and puberty hit, things suddenly got worse for her. She was unable to walk and was in a wheelchair, and I searched the internet for answers, couldn't find any. I kept going back to the hospital repeatedly, and at that time we lived in Cairns, which is a very regional area, and in Cairns you don't have much access to specialists. So I kept going back to the hospital saying something's wrong. She had lots of health issues, wasn't able to walk, had severe pain. They took out her appendix and it wasn't her appendix, she was still in pain. So I did a lot of searching on the internet, and we also travelled interstate to try and find doctors who knew what was wrong with her. In the meanwhile, what I didn't know was that Cairns Hospital had labelled me as Munchausen, that was causing my daughter to be sick, and had also reported me to Children's Services, but they didn't have a case to answer. But those labels and misdiagnosis and mistreatment, they stuck on her files. And so anywhere we went around the country, those labels and records followed us. They affected the treatment that my daughter got, and in some cases was refused treatment. So we had a major Brisbane hospital say that she needed internment in a psychiatric facility to learn to live with the pain that she had, because they kept telling us it's all in her head. We had a doctor say that she was severely emotionally retarded, and that stuck on her files and affected every treatment that she had after that. That was really, really difficult to accept, because as a mum, the last thing you ever want to do is hurt your children. So to be accused of hurting your children on purpose to get attention or to get drugs was just absolutely heartbreaking. On top of that, when my daughter had recurring dislocations of her shoulders and knees and hips and other joints, the Cairns Hospital accused her of doing it on purpose to get drugs. And one of the symptoms of Ehlers-Danlos is, because it affects your connective tissue, is recurring dislocations and subluxations, because the ligaments are too soft and they can't hold the joints in place properly. So after about the 6th dislocation, the hospital decided she was a drug seeker, and they refused to put her shoulder back in. And on top of that, they called the police to come to the emergency and remove her from emergency with a dislocated shoulder.
That must be, I couldn't even imagine what that would feel like, where you have to justify things like that.
Yeah, we found that a very traumatic experience, and it left both of us with post-traumatic stress disorder. In the end, my mum had to go in and help her put her shoulder back in because the hospital had refused. So they didn't recognise that her symptoms were a common comorbidity of Ehlers-Danlos and that she wasn't a drug seeker.
How long ago was this?
That was in about 2016.
Oh, so it's not that long
So
ago.
not that long ago. And after that happened, we decided we couldn't live in Cairns anymore with only one hospital that was refusing to put her joints back in. And on top of that, she had multiple other health issues as well. She had anaphylaxis, she had hernias, but the biggest problem was not having a hospital there that would help us put her joints back in.
What about now? Here.
So we had to move. We had to leave Cairns. We had to sell our house and leave our family and our friends and our jobs and move to Melbourne because it was the only place we knew where there might be some doctors who had some understanding of Ehlers-Danlos, and we would have a better choice also of hospitals. When we first got to Melbourne, my daughter had multiple dislocations again, and at one point she had 9 shoulder dislocations within 1 week. The major hospital that she went to in Melbourne got the files from Cairns that said she was a drug seeker and that I had Munchausen, which I don't, but they then acted on that, and for 3 days they left her with a dislocated shoulder, believing that she would be able to put it back in herself, which she couldn't. Finally, a surgeon came and had a look at her shoulder, and they ended up taking her to theatre and putting her shoulder back in. And he explained to me that one of the problems was that because of limited hospital funding, the hospitals were only allowed to take 1 X-ray of the shoulder. And with one 2-dimensional image of a shoulder that is not only dislocated but also subluxed, it was really hard to tell on the X-ray whether the shoulder was actually dislocated. So they were relying more on the records that had followed her from Cairns and relying on one image instead of using their eyes to see the bone sticking out the back of her shoulder. And so after that, the hospital decided to write a plan for her so that when she came into hospital, they would know what to do and they would understand that it was an Ehlers-Danlos symptom and not her being a drug seeker.
Once you got that plan, was it a relief of some sort?
That plan absolutely, definitely helped us when we went to hospital because she's since had multiple dislocations of her shoulder and hips. And so that plan really helped us. But she's now gone on to develop further symptoms, and she now has gastroparesis, which means her stomach has shut down and she can hardly eat. She's lost a lot of weight, and that's a life-threatening condition. But one of the hospitals in Melbourne misdiagnosed her as being anorexic, and so she wasn't getting the right treatment. Once we found a hospital that did recognise what she had, then she was able to get the right treatment, and she ended up with a nasogastric tube, and she's now fed nutrition through the tube. Since then, she developed a complication with the tube. She's had a tube put in her stomach now, and then she developed a complication with that because of the Ehlers-Danlos. They tried to replace the tube, and they had a lot of problems because her stomach is anatomically different. They had problems with placing the tube correctly, so the surgeon left the tube coiled up in her stomach, and for 5 days she was in agony, and finally they had to call a surgeon in to redo the surgery because it had failed. So currently, even though we have a diagnosis, the main problem is that there are not enough doctors who know enough about EDS or have had any experience with EDS. There's just not enough awareness, education, and the information that does get down to doctors is often out of date. There's very little compassion for people with complex medical conditions. Hospitals and emergency departments are just not set up for complex conditions that require some time and effort on the doctor's part. It's not their fault. They're underfunded and overworked, but we really need to improve education for doctors. I'd really like to see specialist clinics that deal with people, particularly children, with complex medical conditions. I'd also like to see a national rare disease plan in Australia, because every other developed country in the world has one and Australia doesn't. I'd also like to see some tele-mentoring programs run for doctors. And there is one in the United States at the moment called Project Echo that is specifically for doctors to tap into and gain some expertise around rare genetic conditions. Well, because I have Ehlers-Danlos myself, and that brings along with it symptoms and fatigue and pain, sometimes it is difficult to keep going, but as a mum, you keep going for your children. And also, I run a support group for people with Ehlers-Danlos, and I do get a lot of contact from people, patients, who are feeling suicidal because they don't have enough support from their health professionals, they don't have enough understanding, they feel like they're not supported, and they are also suffering from relentless, untreated pain. So it's very difficult to deal with people who are in a suicidal state of mind. And I don't have any training in that area, so I do the best I can. And I myself, I see a psychiatrist to help me deal with those issues and to also help me cope with having 2 children who are in and out of hospital and facing life-threatening conditions.
I think it's important that you look after yourself.
Yeah, it is really important to try and take some time out. But one of the things that keeps me going is that working as a carer, not only for my own children, but for children in the support group, that provides me with a lot of motivation to keep going because I can see how it helps other people. Unfortunately, there's a lot of misinformation about Ehlers-Danlos in the health community. It used to be called a benign condition, which meant that it didn't hurt you and didn't cause pain, but they now know that's totally untrue. It's a very painful, very disabling, life-threatening condition, and it's multi-systemic. So many of the health professionals we see don't realise that up-to-date information is available, but it is hard to find. And one of the things I'd like to see in every hospital in Australia are clinical treatment guidelines for patients with Ehlers-Danlos that are up-to-date and readily accessible in every emergency department and every hospital, and also available for GPs as well. So in the United Kingdom, they have written a GP's toolkit on Ehlers-Danlos Syndrome, and they have that available to all GPs across the country. We don't have anything like that in Australia, and we really need it. Most of our information comes from the Ehlers-Danlos Society, an international group based in the United States, and Facebook groups and the internet. Facebook groups have been really helpful and really supportive, but they don't provide face-to-face contact for patients, but that's where most of our information has come. But even now, like when I spoke to a doctor just last week about accessing Project Echo, which has a lot of information on Ehlers-Danlos, his response was, but I probably won't see another Ehlers-Danlos patient for at least another 3 years. So I don't need it. But that is putting patients' lives at risk. If you don't know that your patient has fragile tissues, then surgeries will sometimes fail because they haven't allowed for the fragility of the tissues and they need extra stitches. They may have bleeding problems after the surgery. They need extra healing time and they need the stitches to be left in longer. So there's all sorts of little issues like that that really help with the patient's recovery. And it's life-threatening if the doctors are not aware of that before a patient goes in for treatment. There's also not a lot of treatments available for Ehlers-Danlos as well, but there are some allied health practices that can help you manage the symptoms. And on a care plan, you can only get access to 5 visits per year. And that is nowhere near enough for someone with a connective tissue disorder. And they're often preventative. So we really need more access to allied health. A person with EDS usually requires a team of at least 8 specialists, and they charge a lot. And Medicare doesn't cover the costs. And there aren't enough EDS-aware specialists in public hospitals. So often you're forced to go privately because the waiting list is just too long for people with complex conditions. I really feel sad for people who are in regional areas and my friends back in Cairns, because I can now see how lucky we are in Melbourne to have access to children's hospitals, to transition programs, to much better choice of doctors and hospitals once you reach the adult stage of living with a genetic condition. People in regional areas, they don't have ready access to specialists. They're lucky if a specialist comes to town once every 6 to 12 months. They don't get second opinions. They don't get travel to capital cities or interstate to see experts with their genetic condition. We found a clinic in Sydney that specialised in connective tissue disorders, but we weren't allowed to attend because we didn't live in New South Wales. And that has to change. You have to have specialised clinics available to everyone in Australia. So coming down here, we do have a lot better choice now with doctors and hospitals. We still have to shop around to find doctors who know about Ehlers-Danlos. And that's really expensive and time-consuming and really difficult on people who already have a disability to deal with. We have found a few doctors in Melbourne who have an understanding of Ehlers-Danlos. One of the problems we have is the cost of seeing those specialists. If you go through the public system, you have to wait 6 to 12 months to see them. And if your symptom is disabling and you can't work and you can't go to school, that's a long time to wait. Some of the doctors have been really understanding and compassionate about our problems, but often their hands are tied by the health system.
How?
So to give you an example, my daughter needed to have a feeding tube in her stomach and a JPEG, and we were told that if she waited through the public system, it could be 6 months wait. And then meanwhile, she's down to 43 kilos, losing weight rapidly and unable to eat. So we were told we could go through the private system, it would be a lot quicker. But if we went through the private system, she would then be ineligible to join the home feeding program to be able to access the feed she needs, subsidised by the hospital. So I questioned, why would you have private health if it then prevents you from accessing public health programs? And I actually wrote to the Minister for Health to ask him why this was so. And he came back to me and said, that's not supposed to happen. So again, there were issues with what hospitals were deciding patients would be eligible for when the health department was saying something different. So it's quite confusing, and obviously she needed access to the hen program with the feeds, and she's only 23, so she needs access to that program probably for the rest of her life. And so to be denied access would have been extremely costly, and on a disability support pension, she wouldn't have been able to afford it. Okay, our biggest problem was constantly being labelled with a psychiatric diagnosis. It's all in your head. So then patients actually refuse to go to psychologists because they feel like then they're admitting, oh, well, it must be in my head. They know it's not in their head. They know there's something wrong. And so we were actually offered too much in the way of mental health help. And that was not the answer. The answer was to find what was the overlying condition, the genetic condition that was causing all the symptoms, instead of brushing off the syndrome as being too difficult, too hard, too many symptoms, the patients being difficult, when it was the disease that's difficult, not the patient. And we really needed more medical help to make sure we had the right diagnosis, to get it treated properly and get it treated early. So when my daughters were diagnosed back in 2013 something, there were no support groups in Australia that were active and were face-to-face. There were a lot of Facebook groups with a few members. So I joined the International Ehlers-Danlos Society and I became an affiliated member, and I got a lot of up-to-date information from them. And then I decided to start a support group in Cairns so that my daughters could have some support and meet some other people with Ehlers-Danlos. And we actually had more than 30 members, and we had people from birth to 80 years of age. And we had people who were like 67 and just got their diagnosis. We didn't have any life insurance issues because we weren't diagnosed. So I had multiple health issues, and I was even told after my second child that I shouldn't have any more children because my tissues were so fragile that it would be dangerous. And yet still there was no mention that I might have a connective tissue disorder. So I passed that on to my children without knowing, and the same happened with my husband. He didn't know that he had a connective tissue disorder either. The only problem we have had is with travel insurance. You have to declare that you have a pre-existing medical condition, and that made our travel insurance much more expensive. When you join private health insurance, you have also longer waiting periods for a pre-existing condition. So again, you have to declare what existing condition you have, and so then you have to wait longer for surgery, whatever you need. Okay, in 2014, my daughters and I were invited to speak to Federal Parliament in Canberra about the need for a national rare diseases plan for Australia. And I think this is really vital for young people and children. If we don't diagnose these complex genetic conditions early in life, they don't get the right treatment. They can easily be misdiagnosed, and they miss out on early intervention, and so therefore it just makes everything more complex and more costly for families. One of the biggest problems with Ehlers-Danlos is that children present with bruises, fractures and scars. And so parents are unfortunately blamed for abuse or labelled as having Munchausen and causing that illness to children. This then results in children's services being called in, and that has an incredibly detrimental effect on families. EDS can and does destroy families. I know of a family right now who are battling with a label of Munchausen, and children's services were called in, and they have now been denied the opportunity to have second opinions on their daughter's condition. So that means she's never going to get the right diagnosis or the right treatment unless the hospital starts realising that all her symptoms are from EDS. The unfortunate thing is that some of the comorbidities of EDS are not recognised and not treated in Australia. And so in the future, I may have to take my children overseas to have correct treatment for their symptoms. And we really need education of doctors in Australia so that this doesn't happen to other parents.